Let me begin with something many of us grew up believing. If you work hard in school, if you get excellent grades, if you enter medical school, pharmacy school, nursing school, or dental school, then your future is secure. That was the promise back then, that you study hard, you get the degree that you need to get, and the career will take care of itself. For many years, that belief made a lot of sense. Healthcare professions were seen as stable, they were seen as respected and almost guaranteed pathways to employment. But today, something has changed and the story has flipped across many countries, including right here in our region and in our country. We are seeing something that would have sounded impossible a few decades ago. The highly qualified healthcare graduates, they're struggling to find opportunities. Doctors are waiting for internship opportunities. Pharmacists are competing for limited positions that are available. And young professionals, they're feeling uncertain about their next step career-wise. And that raises an uncomfortable question that all of us need to ask ourselves. What really happened to the promise that high grades will guarantee a stable career? Well, the truth is that the world around healthcare has changed dramatically. That is the truth. But the advice many students received has not changed with it. So to understand this, we need to look at how the healthcare ecosystem used to work before. Now, years ago, the number of healthcare graduates was relatively small. Governments trained a limited number of doctors, pharmacists and nurses, hospitals needed staff, healthcare systems, they were expanding. And in many places, governments absorb most graduates directly into the system. The moment they're done with their studies or internship, they're absorbed into the system. So naturally, people began to believe something, that once you got the degree, the system will carry you. But over time, several things started to shift. Over time, we saw change happening. Universities expanded, more training institutions opened up, and more students they entered healthcare programs. At the same time, healthcare systems did not expand at the same pace, and slowly the balance changed. So instead of a shortage of professionals, many regions began experiencing competition for limited opportunities. Now, suddenly, having good grades was no longer the only factor. And this is where many young healthcare professionals experienced their first career shock, because they did everything they were told to do. They studied hard, they sacrificed sleep, they passed the exams, they earned the degree, but the system they expected to absorb them is no longer structured that way. Now, that is the big challenge. Another important change is the evolution of healthcare itself. Healthcare today is far more complex than it used to be. Now, hospitals are only one part of a much larger ecosystem. There are pharmaceutical companies inside there. We have health technology firms inside there, research organizations, or sometimes referred as clinical research organizations, health insurance systems. We have public health programs. We have policy institutions. Talk about digital health startups and many other sectors connected to healthcare. Yet most training programs, they still prepare students almost exclusively for clinical practice. Almost exclusively for clinical practice. So when students they graduate, many of them are aiming for the same narrow set of roles. You talk about hospital positions, clinical placements, traditional healthcare pathways, but the number of people pursuing those roles is growing every year. And naturally, competition also increases, because the number of people aiming for those positions are keep on increasing, yet the opportunities are not increasing. So competition increases. And there's also something else that is happening with the healthcare space, and this is healthcare careers. They are becoming more skill-based rather than purely qualification-based. In other words, what I mean is having the degree opens the door for you, but what you can do with that degree matters even more. Today, employers are looking for additional competencies. Talk about communication skills, leadership skills, systems thinking, research capability, digital literacy, understanding of healthcare systems, strategic thinking. All these competencies are what the employers are looking for. So these skills, they're not always emphasized in traditional healthcare education, but they're becoming increasingly important. So while high grades still matter, they are no longer the only thing that determines opportunity. They still matter. Now, this can feel discouraging at first. I understand that, because many students, they grow up believing that academic performance alone determines success. But in reality, careers in healthcare today, they're becoming more diverse than ever before. So the opportunities, they're expanding beyond traditional clinical roles. And doctors are working in pharmaceutical development. We have pharmacists who are contributing to health policy. We have healthcare professionals who are building digital health platforms. So things are evolving, and some are leading even research initiatives. Others, they are shaping national healthcare systems. So the key difference is this. Here is a key difference. They didn't just rely on their degrees. Those that I've mentioned are in the different spaces in the healthcare space. They didn't just rely on their degrees. They positioned themselves within the broader healthcare ecosystem. So perhaps the real lesson here that I want you to take is not that high grades are useless. They are still useful. High grades are still valuable. They demonstrate discipline. They demonstrate intellectual capability. They open doors to training opportunities, that is high grades, but they are only the beginning. The healthcare world today, it rewards professionals who combine academic knowledge with strategic thinking. So those who understand systems, those who explore different sectors, those who develop additional skills alongside their professional training. So for students and young professionals, this means something very, very important that I would like you to take note of. Your degree gives you a foundation. That has to be very, very clear. Your degree gives you a foundation, but your career will be shaped by how you apply that foundation. Some people will follow traditional paths, others will explore new ones. Both are valid. The difference is intentionality. So being aware that the healthcare system is evolving and being prepared to evolve with it. So when we say that high grades no longer guarantee a job in healthcare, it doesn't mean academic excellence has lost its value. It doesn't mean that. It doesn't mean that academic excellence has lost its value. It simply means the rules of the game have changed. The profession is becoming more and more dynamic, more interconnected, more competitive, but also more full of responsibilities and opportunities. So the real question is no longer just how well did you perform in school? The real question is, how are you positioning yourself in the healthcare ecosystem? That is the real question. That is a real question that I would like to leave with you. So if you're a student or an early career professional watching this video, here is something for you to remember. Your degree is not your final destination. It is your starting point. From there, your curiosity, your adaptability, your willingness to learn will shape the path ahead of you. And that's something we will continue exploring here on the Medical Hub. So if this conversation resonated with you, let me know in the comment section. And also remember to subscribe and to click the notification bell so that when I put up the next conversation, you can be in the know. See you in the next conversation. Bye bye.